Thank you, everybody, for being here. We've been giving daily briefings via Facebook Live, which many of you have been following, other briefings when there are material changes in the situation on the ground. Before we get into, just to clarify a couple things, there are still 21 quarantined individuals in Onondaga County. There are still no individuals who have tested positive for COVID-19. A couple other points for our business community. We've been encouraging now for a couple weeks to really focus in on the continuity of operations, looking and assessing your technologies to see if it made sense for employees to work from home. In cases, we want to continue to encourage our businesses to do that. Also, we've been talking about dealing with employees related to sick time. We do not need employees coming to work sick, whether it's in this building or any other building or in your own business. The last thing you need as a business owner is to have one sick employee get the rest of your workforce sick. Very hard to operate your company at that point. So we are asking the private sector to really work with their employees and really help define a sick leave period. And there's lots of different things that can be done with that. Let your employees earn back sick time once we get through this process. In addition to that, to the community, it's very important that we support our local businesses at this time. Our local businesses are hurting. There's certain tourism and hospitality industries specifically that are hurting, and we need to support them and help them through that. That's part of our community rallying. So certainly we're encouraging everybody to still go to utilize your buying power to help our local economy, going to restaurants, buying from restaurants, and continuing to invest locally here. Throughout this process, we have told you we are taking a data-driven approach to all decision making. Every morning at 9 a.m., Dr. Gupta gets to see her favorite person, me, and let me know what's going on related to what our health department is seeing, what our experts are seeing in the space. Over the last 12 hours, there's been a change in the data, and a couple different things have happened. One being in Albany County, there was 2 new cases. Albany County being on the thruway 2 hours away. 2, Monroe County, on the other side of the thruway, there's a confirmed case. And 3, when we look at our curve, this time of year with respiratory illness, the curve is supposed to go like this, and the curve is staying flat. And so looking at all of the data, I spoke with Mayor Walsh, and we talked over the situation with the St. Patrick's Day Parade and the various concerns, the pros and the cons to have it. We consulted with the St. Patrick's Day Parade Committee, and the decision was that we are going to postpone the St. Patrick's Day Parade due to the data and the information in front of us today. This is an evolving timeline. We saw what happened when it comes to situations of mass gathering with the decisions that the NCAA made. The NBA's was a little different. The decision-making process may have been a little bit different if they didn't have a player and a whole team exposed to the COVID-19. But certainly they were going in the direction that they were not going to be having mass gatherings of fans in their sports as well. So the information continues to come in and continues to impact our decision-making process. But we are very, very lucky here in Onondaga County to have the medical infrastructure we have. Dr. Gupta and her team are doing a tremendous job. Dr. Thomas is really helping lead up a effort with all of our area hospitals. And so we're very, very lucky. We have a chart here. We'll let the doctors get into it more. But the premise is this. The longer we go without a positive case and a community spread, the more capable our medical infrastructure is to handle what is really inevitable at this point. So by not allowing these mass gatherings, that is certainly going to help us keep that curve where we are and give us more and more time so that certainly our teams are prepared for what may be inevitable, and certainly the community is not impacted. Saying that, at this time I'm going to turn the microphone over to Mayor Walsh, then we'll hear from our medical team, and then we'll take questions. Thank you.
Great. Thanks, County Executive. I want to reiterate our appreciation certainly to Dr. Gupta, the team at Upstate, and the County Executive for his leadership. We have been in constant communication. Relative to the St. Patrick's Day Parade, obviously that was that was a difficult decision to make, but it's a proactive, precautionary step. It reflects the responsibility that we all have to take care of each other. As recommended by the State Health Department, we're looking at other ways to reduce density and to limit large gatherings. We're currently the city's doing a comprehensive review of all permitted activities and all city-hosted events over the next 60 days to determine what, if anything else, should be postponed. In the meantime, we want to reiterate the importance of using common sense, practicing good health habits, making good decisions about where you go, where you might be putting yourself or others at risk, having close contact with each other. Want to just make a few points about what we're doing as an employer at the City of Syracuse. At this point, there are no changes in city services and city facilities, but we are actively reviewing. As the county executive said, this situation is changing by the hour, if not the minute. And so we're using, at every decision point that we make, we're using the best data that we have available to inform that decision. On that note, we have not requested that any city personnel move to remote work, but we have introduced remote work options and are looking at expanding our capacity for remote work. We are providing updated guidance on city employees that have constituent-facing positions that are interacting with the public regularly. We have updated our travel guidelines for employees that are traveling on official business. We've introduced enhanced cleaning protocols, not just in City Hall, but through all city facilities. As of right now, all public meetings are still scheduled to happen, but I do want to remind everyone that we have a YouTube channel where all of our public meetings in City Hall chambers are broadcast. So if you're interested in hearing what's going on, whether it be a council meeting or a planning commission meeting, you can tune into YouTube and you don't have to show up at City Hall. At this point, I'll turn it back over to the team, but again, I want to recognize everyone around this room for their support, and I can assure you we are all working very effectively together, taking this very seriously, but also making sure that we're not getting ahead of ourselves or getting ahead of the data. Thank you.
Thanks, Mayor. Dr. Gupta.
So good morning. I just wanted to re-emphasize the same thing which County Executive and Mayor has said. If you think from the timeline, how it has evolved in such a short time frame, in December, how many people were thinking about this when some news articles have talked about something is happening in Wuhan City in China? Nobody was thinking about that. Then WHO came and then say, oh, there's something happening, they reported. Fast forward in like 2 months, today, March 12th, we have the public health emergency was declared by WHO on January 30th. January 31st, President declared travel ban for China. And then we have overwhelming cases throughout the Europe and now coming to United States. And also we started to see in the hot pockets in Westchester and in Seattle and California. A lot has happened in such a short time. Yesterday on March 11th, WHO declared pandemic, which raises the bar for everybody, not for anything else, but what our leaders are doing at this point, both from in terms of social distancing, how to promote the prevention part. As of it now, we do not have any case, but we are preparing to make sure it takes as long as to have that case get introduced to infection comes to our community, and if it does come, how can we reduce the transmission of infection? That's what we are trying to do. So all effective work with the health systems. We are working with Upstate, St. Joe's, Krause, VA, and to the primary care provider, and to the CBOs, and you name it. I mean, from schools and everywhere. We are working together to make sure we are in prevention mode at this point, but at the same time, ready to have that surveillance, case detection, and making sure putting the isolation quarantine, which is need to be done, as well as supporting the people who are going to be impacted through our emergency management support through the Commissioner of Emergency Management with the Human Need Task Force, which the county is very much dedicated to. So this is work together, but at the same time, my always ask has been to all of you, to the community, what can you do to participate in taking care of yourself, to prevent the transmission of the virus to somebody else by making sure you stay home if you're sick, call the doctor if you're sick, do not show up to the emergency room without talking to them and with their consult that's what you should be there, and taking all the precaution and talk to your friends and neighbor and support each other. So thank you.
Thank you. Dr. Thomas, do you have anything to add?
So I would just reiterate that, of the people who get sick following a COVID infection, 80% of those illnesses are going to be mild illnesses, and about 20% of those illnesses are going to be severe or critical. And it's that 20% that is going to need to be in the emergency department, and that's going to need to be in the hospital. Hospitals and medical care infrastructures, they do have some surge capability, but it is not limitless. And so we really need people to follow the advice that we were just given, that if you are not in a 911 situation, please call your medical provider, get some counsel, get some guidance. They may tell you that you are okay and that you can stay home and that they will follow up with you. If you need a face-to-face interaction, it can be done in the primary care setting. Again, they will likely be able to send you home, follow up with you, but you don't need to come into the emergency department and you don't need to come into the hospital. Because we are already seeing, again, as you were saying, the number of respiratory infections is supposed to be coming down at this time of year, but the curve is flat. And so we're concerned that we're going to get towards that, we're going to outstretch our surge capability, and so it's really important that every resident and every citizen, I think, follow this guidance.
Thank you. And one thing just to touch on is more more testing is being done now. So really speaking to the public, in the event that you work through your doctor and you get a test, just to reiterate, when you have a test, if you're being tested, you should be under a self-quarantine until you know the results of the test. So I think that's just an important point in all of this, certainly. And again, there are many, many other reasons why people are still going to hospitals and to emergency rooms. That's why it is so critical that you don't just show up if you have flu-like symptoms. You need to call your primary care provider, or you need to call urgent care. You need to call the emergency room and really have a coordinated path to getting the treatment that you need. Saying that, questions?
Ryan, at what point did you realize the situation had changed enough to postpone the parade?
Yeah, look, there's different pressures. I'm pretty sure the mayor could probably confirm this, that all of the commenters from Syracuse.com that can't comment anymore have gone directly to our emails. But
that's confirmed.
Yeah, so there's the reality and the anxiety. We can feel the anxiety. We're fielding the calls. We're talking. We understand it, but we need to make decisions on data. And so last night I was speaking to county executives across upstate New York that are in similar situations that we are. And actually I spoke to every one of them that has a city, and the mayor's probably talking to their mayors at the same time. And so we were looking and we're comparing notes, and certainly I think when Monroe County confirmed that their first case, that changes things. Our communities aren't connectivity between our communities, and then obviously Albany County too. So you're looking up and down the thruway. Certainly, in the president's address last night, some of the guidance that the CDC's been giving, these are all things that we're not going to ignore the advice medical community that are trained to help give good advice. And so when you weigh it all in and you weigh the pros versus the cons of having talked a lot about that, and there weren't many pros at the end of it. We're postponing an event. We're going to have a great St. Patrick's Day parade at some point this year.
Do we know when that is?
We don't.
How can you stop people, let's say, this weekend from crowding in Kitty Points? I mean, that's,
Yeah.
the end of the parade, which is kind of outside,
Yeah, look, the answer is we can't. So that's, I mean, part of we still don't have any confirmed cases, Alan, but what we're doing is we're buying time. And sometimes you can't control that, and you can't buy time, right? But this is one area where the mayor controlling that permit, department controlling the public health element, our office, in discussion, something we can control. And so many of these things we can't control. They're out of our control. And by implementing this practice, looking at the data, we think we're giving ourselves more time or position to get more time.
Was there a threat of a permit being pulled or your executive order to shut down?
The mayor can confirm this as well. We spoke this morning, we spoke last night, we spoke this morning, and we were sharing data, sharing information, sharing concerns, and everybody came to the conclusion. Yeah, as usual.
Why are we canceling the parade? Why is it
Hopefully this is a period of time in 2020 that we're going to be able to look back on and say the community was challenged and the community performed well, and let's get on with life again. And so the more time we can get through this without having a huge that gives more time to the medical community to work on potential medical solutions to the COVID-19.
Because there are cases now in our neighboring large counties, not directly neighboring, but down the thruway, like you said, because those counties have confirmed cases, do we now treat patients coming into medical facilities differently? Is community spread more possible today than it was prior to these cases, where travel is no longer a requirement to test for COVID-19?
Yeah, I'll let the doctors if they feel I'm going off track, they always have the right to pinch me. But I think, Andrew, that for the medical community too, guidance is changing and all the time as well. And certainly before COVID-19 was on our shoreline in our country, it was probably looked at differently and treated differently. But the reality is it's still flu season. Part of these mass gatherings can put people who are susceptible to the flu, who are at risk, susceptible to that as well. But I'm not going to talk about the medical communities the way that they've changed. I don't know, Dr. Gupta, if you want to touch on that question, or Stephen. But overall, everything's evolving and the guidance is evolving.
Yeah, so it does impact in terms of that how is your neighboring counties, because these people travel, and that actually weighs on to the doctors who are seeing the patient. They're going to do a thorough history, but at the same time, were you in the same connectivity? And sometimes if there is a suspicion that it should be, then they should be testing it. I think Dr. Thomas can directly talk about that because he's directly involved in that.
Sure. Yeah, I mean, at Baseline, we have a very international community, and we have a community that's very mobile. And so the fact that we have 2 cases in Saratoga County or Albany County or one in Monroe doesn't really change the calculus that much, to be honest with you. I mean, for the last couple of weeks, COVID has always been in the list of potential causes for a respiratory infection. As was mentioned, we're in a good position here in the sense that we have not diagnosed a case of COVID in central New York, because we can live in 2 worlds. We can live in we're still in prevention mode world, right? Like the decision this morning. And we can also live in the mitigation world, meaning we are going to plan for what hopefully doesn't happen, but what may happen, in that there's sustained community transmission. But at the patient to doctor level, it was always, at least for the last couple of weeks, it was in the list. So the close cases, it doesn't necessarily really change that at all.
Dr. Thomas, some people's only access to medical care is the emergency room.
Mm-hmm.
Is the hospital taking steps to separate a person who thinks they may have COVID-19 from somebody who has a broken ankle?
Yeah, so, I mean, it's the same steps as if we think they have influenza, if we think they have tuberculosis, if we think they have some other potentially communicable disease that could be transmitted through a respiratory route, it's the same thing.
Is this data, Onondaga County data, where respiratory, I guess diseases are staying the same? So when somebody has a cold, they go to their doctor, that you're getting a report from them that someone has a respiratory illness, I guess. You get a report from them.
Right, so Dr. Gupta can comment on this as well, but yes, so there's a network that is constantly tracking influenza-like illnesses and feeds that data to the state, and the state then feeds it back. We have our own internal data, of course. This is something that we're always kind of tracking. So yes.
I've heard that some patients are getting conflicting information. You know, they're told to call their doctor. I talked to a woman yesterday who did that, and she said the doctor told her to call the health department. I think she called the state health department's 888 number, and no one answered. And then she got through to someone, and they said, call your doctor. So it's kind of like, who's on first?
Right. So I think there is a little confusion in everybody's mind. That's true because it's so new. You can see the timeline. It was so short. Their new guidance has come. They change in 48 hours in terms of having local health departments are the, like I should say, approval for any testing to move to the primary care doctors or the doctor who's seeing based on the judgment. I think we talked about during the last meeting also here is the New York State Department have the very clear guidelines. There are 5 criterias in which gives very clarity, and they're posted on their website. Anybody has access to. You all can go through that, go to the healthcare provider section, and you can actually find them. So the physicians know their patients. So if I have so many patients, let's say, if my patient calls me, I would know who or she is, then I'll go and screen and triage them and say, did you go there? Did you do this? And following all those things and take a good history and say, okay, I don't think you actually are at a high risk, so I'm not concerned about that. And if they are concerned about that, they can go ahead and try to plan for the testing of the order of the test. The one part is the one guideline is there is that if there is a confusion, if somebody who is vulnerable, if that feel like maybe low index of suspicion, then you work with the local and state health department, and we work and we say, okay, that makes sense, it's logically, so let's go for the test. So
there's a fair amount of confusion
right.
among the primary care doctors.
So we are working on it. That's the only thing. I know Dr. Stephen has been working. We are working together with the other leadership in the physician community and continue to have the same dialogue. You're absolutely right. There's a little confusion because the way the guidelines were rolled out, and we are trying to remind them this is something we need their engagement, and we need them to screen the patients. That is important for them too, so they can order the test themselves, because what is the point of having availability of tests if the primary care are not involved? Because health department alone cannot do that. ER cannot do it alone. They are getting the sickest people for the most part. That's what we are hoping. We don't want people to line up the ER because they want the test. So that's the guidance is to call the doctor if you are sick, if you're feeling symptoms. And my ask of all of the community is make sure you're well informed. And we have talked about this. Go to CDC website, go to New York State Department of Health website, go to Onondaga County Health Department website, and see where do you fit in. People are smart. They actually, information is in their fingertips, and talk to each other, support. The families need to support each other. Kids need to support the parents and grandparents, the neighbors, and have a discussion. Don't go to any crazy website. I always said don't go into hoax and fake news and all those things. Please stick to the scientific-based information. And that's what my biggest ask is. That's what I said. How can people participate in taking care of themselves?
If a primary care doctor orders a test for his or her patient, are the doctors equipped right now to take the swabs themselves, or do they have to call Upstate or Krause and say, I have a suspected patient, and have the hospital do it in an isolation room?
Right. You want me to answer that?
Yeah.
Yeah. You've asked a really complex question because you have individual hospitals, they have hospital systems and hospital infrastructures, and then you have ambulatory care clinics that are associated with each of those hospitals, and then you have primary care, could be private, that could be associated with those hospitals. And then you have urgent care that's even another, in this county alone, 14, 15. And so what we're trying to do is, and you have a testing capability that initially only existed at the CDC, now exists at Wadsworth, and now you have commercial labs coming on board. So this is a constantly evolving playing field that trying to come up with systems and processes and then trying to communicate all those, it is absolutely a challenge. So for example, there may be some primary care offices where they say, I have enough masks, I have enough gloves, I have enough goggles, and I have nasopharyngeal swabs because I do flu testing normally. They could do business as usual, and whatever lab is going to do the COVID testing for them, they'll have a courier, they'll come and get it, they'll take it away. There are other places that don't necessarily have that. So what we're trying to do with kind of our COVID team is make sure that we're interfacing and networking with all those primary care offices, make sure that we're networking with the urgent care offices, doing gap analyses to find out who has what, and then trying to get them the resources that they need so that, again, it's that 20% of a high-risk population that are the sickest that can enter the hospital system, and the others can stay out into either managed from home or managed in the primary care setting.
What's the status of the test processing in upstate?
So, like timelines or, yeah. So if I see somebody who COVID is on my differential diagnosis, I can easily get a swab, I can easily put on PPE, I can collect the sample that I need to, it goes to my lab, and right now I would say that we have been testing people. The Wadsworth lab has really been doing an incredible job. The turnaround has been incredible. So at least the last couple tests we've sent, we get results in less than a day.
Let me clarify, the actual sending of samples to upstate to be processed. One of the governor's directives was to allow test processing in upstate.
In your own lab?
So again, so I just mentioned a bunch of networks. We don't manage the processing of samples for all of those networks. Right.
Did the governor specifically call out upstate as a possible place for test processing?
It's possible that he did. I'm not aware of that particular.
It's not, to our understanding, it's not
It's a
happening
work
yet.
in progress, I think.
Yeah.
Just for social distancing.
Yeah.
Has there been any conversation with places like the fairgrounds, given their upcoming expos and clear for that?
Yeah, we're considering social distancing policies. This was an easy one because it's a mass gathering, and we have guidance on that. We have data to show that this is something that will help us keep that curve going in the right direction. As we get more information, we'll implement more social distancing policies on our side if individual groups aren't doing it themselves. Right now, again, we don't have a confirmed case at this point, so a governmental social distancing response isn't appropriate as of this time right now at 11:40 on a Thursday afternoon. That could change at 2 p.m. on a Thursday afternoon.
Does anyone have an idea yet how many people have been tested in Onondaga County?
I don't know the numbers. I know that the testing numbers have picked up just like other communities. And we certainly, Andrew loves this question too, Jim. Certainly, once we have a confirmed result, we'll get back together again and we'll have a conversation talking about
We
that.
have no idea how many
No, of course,
people have been tested.
that's a moving target. I don't know if we have a whiteboard that shows each day this many people were tested or whatnot, but that's a moving target by many different folks. And I think to your question earlier about the process is going to continue to evolve, and the process may change as far as testing goes in the event of a community spread. So I think to the point, our medical teams are doing a great job staying in front of it and trying to communicate with these primary care providers. Many of them not used to really doing this, but certainly in the event of a community spread, we'll then really lean on some of the emergency management plans that our medical community and our emergency management team have been working on at that point.
But does the county not know now?
Dr. Gupta, do you want to?
So because any primary care provider can order the test, right? So they don't need our approval. And what will happen that we get the report of them next day. So we get all the results, negative and the positive. So we will know it afterwards. We will not know it beforehand because there's no other way to do. So everything goes into the secure lab system, which we are responsible for our community like any other local health department. So we will have all that data once the tests are done.
So you don't want to say how many, let's say, negative tests you've gotten back and looked at?
So right now, I think we are focusing on, do we have any positive? Because if you think of that, and I don't want people to focus on how many negative also, because it just creates a lot of anxiety. How many tests are done? What are you doing? How many? That indirectly relates to and it feeds to the anxiety of people. Oh my God, so many people have this problem and so many people are being tested. No, that doesn't mean that. Because the bar has been lowered in terms of testing, that we are trying to identify people before. So it's good that we have a negative testing. And we are looking for, do we have any positive? Our focus is in the positive, and we really are in prevention and mitigation mode. So that's what we are focusing on.
Yeah, but
Thanks.
there's a great deal of concern nationwide throughout your state that there's not enough testing being done. So there may be people who have anxiety because they're thinking, well, if they've only tested 3 people, there could be thousands walking
Yeah.
around, so I'm assuming they have this. So I don't understand the refusal to tell us how many negative tests there are.
Jim, I think it's accurate, though, to counter that, is that there has not been a human being in our county that has been symptomatic that has been refused to test. Okay, so the anxiety there, I had someone send me an email that their question was, why isn't everybody in the county getting a test? It's ridiculous. There's no reason. If you're not symptomatic, you most likely are not going to be carrying COVID-19. So we're people who are symptomatic that they go see their doctor. Again, our infrastructure, what we're worried about here, can't possibly entertain 470,000 human beings being tested for something that we know they don't have. So what we need to focus in on is proper procedures so that infrastructure holds up and that people who are symptomatic get the tests and get the turn time in a very timely basis so that we can then implement our policies and our emergency management plans in the event that we have a case. If we're testing people that we know don't have it, that's going to change everything. The labs are going to get backdated and backlogged and we're not going to know for 3 or 4 days of who's actually positive. And then think about all those contacts that person may have had with the community. So I think this feeds into the anxiety of the community. But what we can say is that anyone who is symptomatic in Onondaga County, that their doctor says needs a test, goes through a review with the health departments, and they get tested. Nobody's been denied that test.
The 21 people who are quarantined all are connected to international travel. Will there be a point where we're asking people to quarantine if they've been exposed to a confirmed case within the United States?
Oh, yeah. I mean, that's part of the investigation. If we get a positive test, the health department's going to go and do a rigorous investigation on who all these people have had contact with, and then those folks are going to be put in a quarantine for sure.
Or a non-positive test, though, because the 21 people for international travel aren't showing symptoms, aren't positive. But what if you were exposed to, like the Syracuse Media Group reporter who was at a conference,
Yeah.
was exposed, then came into contact with workers? We reported that yesterday. Will those people be quarantined?
If they're not symptomatic and they don't have COVID-19, there's no reason to put them into.
Isn't that true for the 21 people from international travel?
Yeah, but again, I'll let the doctors come in. They're coming from areas of direct contact, right? We don't know what we don't know. In these cases, for the Syracuse Media Group situation, we know specifically as follows. The person who tested positive, that person then goes through their investigation with their health department. Who did you have contact with at that conference? They then go through there. Then they look at other people they may have had contact with, and they contact all of them. So again, if there's 30,000 people at a conference, and many of these conferences are that large, and you're here and your contact is here, and that probably never got to you, the health department officials work and through data and science figure out if that's really a situation where there needs to be a quarantine.
If the county is concerned about putting out information
Jim, I don't think that's the case. No. No, Jim, I think you're misinterpreting this. The reality is, if we want to go back and count all the tests, we can probably get that number. It's counterproductive to focus in on negative tests because there's nothing there. It's a negative test.
There's nothing there other than giving people an idea how many people have been tested and how, whether tests are available, whether a lot of people.
We confirmed to you the tests are available.
3 people, has it been 50, has it been 100? I think that's it.
We got it. You want that answer. We got it. We got it. And our answer, we'll come back and we'll discuss it internally. But what we're giving you the important answer on the issue of testing, anyone who has symptoms in our county who their doctor says needs a test has gotten a test. Testing is not an issue in Onondaga County. But we'll collectively discuss.
Sure.
Yeah.
Please interrupt.
Mayor? Yep.
Looking at, if you're looking over permits and things like that, are you, I guess I'm just trying to get a sense, what kind of things are you looking at? I mean, obviously you've got big permits for like big things like that.
Yeah.
But like smaller things like let's say the downtown breakfast, which is later this month.
Yeah, I think we have yet to identify a specific number, a threshold, where we would say that's where we want to draw the line in terms of public gathering. But we want to understand what the universe of decisions is, and then we will, as we have done from the beginning, consult with Dr. Gupta and health professionals and determine where we want to draw that line. And again, as the county executive said, certain things we have control over and certain things we don't. But where we do have control and we can exert that control, we want to err on the side of caution. We want to take the advice of the state, try to de-densify whenever possible. But it really is a partnership between the government and the community. As an example, we once the county executive and I came to an agreement this morning, we reached out to the head of the parade. They obviously were supportive of the decision. Additional conversations happened. I'll note that Ed Riley's here from the Hotel Syracuse, and through subsequent conversations, it was determined that not only the parade would be postponed, but that all related events would be postponed. And that was, that isn't because we compelled the hotel to do it. It was because they took all the information that they had and they made an informed decision. So I would encourage everyone, whether you're in the public sector or private sector, to use all the information that we have to inform your decision making. That's what we're doing right now. Again, we haven't yet determined what the specific threshold is. But we want to understand what's down the road, and as the data continues to be updated consistently, we'll use that to inform our decisions.
Do you have a sense of how much business is going to be lost with this no parade?
I mean, setting aside the parade, there's no doubt that the situation is going to have a negative economic impact locally, across the country, and across the globe. It already is. The extent of it, we don't yet know. But again, as the county executives talked about, to the extent that we can be proactive and precautionary, the hope is that whatever short-term negative economic impact we have by being proactive and precautionary, that will hopefully help us avoid long-term negative economic impact.
Mayor, what's the discussion about rescheduling the parade?
I'm sorry?
What's the discussion about rescheduling the parade?
Well, there's a consensus between the county executive and I and the parade committee that we want to reschedule it, but until we see how this all plays out, it would be premature to begin identifying specific dates.
What about some of the other big events? I mean, the New York State Fair is, I know we touched on it a little bit, but the New York State Fair is only a few months away. Is the possibility of canceling or postponing the fair on the table?
So I'm gonna give the county executive a little break here. Neither of us have direct oversight over the fair, but I think the fact of the matter is, as of yesterday, the parade was on. As of this morning, we sent out a traffic advisory on the parade about the same time I was hanging up with the county executive. That's how fluid and dynamic this situation is. So for us to speculate as to what's going to happen in August and September is not appropriate.
This may be a stupid question, but things are outside, like baseball. When the baseball season
Yeah.
will start in less than a month.
Yeah.
Are things are outside
mean, common sense would assume that, right? But I think the issue is anytime you get so many people together in areas that could lead to a spread, that's something in your control. Certainly with, the professional leagues are all making their positions known on how their seasons are going to be impacted, and that will certainly drive the decision making. I think you've seen. I think the NHL has taken a position today at some point. Certainly, we saw the NBA's position. Major League Baseball is right around the corner. I'm sure they're going to be taking a position on this. There are scheduled crunch games. I believe AHL is also going to be making a position later today as well. So I think right now, the medical community has given the advice to various leaders that these mass gatherings are problematic, and even in communities that don't have a spread yet. And those communities can really get ahead of the curve by doing everything they can to avoid a community spread. In communities that have this situation, they want to temper it down. And I think that's why you saw the 30-day travel ban to all of Europe, where Europe is having some serious challenges right now. So I think this is an evolving situation. We're making decisions based off of data that's impacting us here locally in areas that we can control.
To either of the doctors, I know the county nor the city have jurisdiction over private events, but I mean, Ellen mentioned Kitty Points, Coleman's on Tuesday.
Andrew, we actually do. And
Oh, you do? Okay.
Yeah. So in the event that there is a community spread, and I have powers that Dr. Gupta, with her recommendation, to deal with social distancing, and that could certainly impact the private sector. But we want.
You see on Tuesday shutting down Coleman's on St. Patrick's Day.
Tuesday morning, a final call would be made on that, right? So we would look at the data there. I don't think that's something that we want to get into at this point, but the data is going to drive all this. And at some point, for the business owners, it's going to make sense. Ed Riley came to a conclusion that having events at his hotel on Saturday, he may make some money, but he may end up with sick patrons and a sick workforce, and then his business is then crippled moving forward. So certainly there's going to be there's economic pain today. We're very concerned about this, but we need to make any health-related decisions based off of the data that is right in front of us. And certainly if there's conclusive data that we need to put in social distancing policies for the community at large, we will. Anything else, guys?
You're gonna have a Facebook thing at noon?
I'm going to go do a quick Facebook Live at noon and say the exact same things I said. And then and if Jim Mulder's not watching, I might break his news in his question right there. So he better be watching. Yeah.
Thanks, everybody.
All right, thanks, everyone.